Finn, he is our first baby, but he came early at 24 weeks. He also was born with some other anatomical differences that needed some surgical attention. We've been here for almost 6 months. COVID has changed a lot of things.
It's really hard not seeing family and friends, and we don't have the support of people coming. It's just kind of on Brita and I for the past half a year, and it's been really hard on us.
Just getting snacks and toiletries and all of that, we didn't really feel comfortable going out and doing any of that, knowing that if one of us gets sick, we won't be able to come into the hospital.
There with Care has been great and very supportive of us and getting food and gift cards and lots of resources.
I mean, it's not just the snacks and the food, it's also things for Finn too. He's worn clothing from you guys. Whenever he gets home, he has a pack and play that he can use. It gives us mental space to process and help and be there for Finn, to be able to focus more on Finn and getting him better. I would say that that is the biggest piece for me of why it's important. We're just really grateful, and it's made a huge difference.
Owen turned 7 in February. Everything was normal up until his 1-year appointment. They said, his head's a little big, we're going to refer you to Children's. And after we did the MRI, I knew something was wrong. When they came in, they said, your son has a mass on his head, in his brain. Our whole world just flipped. And it was like tunnel vision. You don't know how to react, and you feel at a loss. We were admitted right away. They could not remove the tumor because it was intertwined with his cerebellum. He was doing really good on the oral chemo. The side effects are the worst because as a mom, you want to help him. You can't just kiss it and make it go away. It's just a tough situation as a mom. My daughter's birthday was on the 20th, and they called us on that day and told us, his tumor grew. We found 2 more masses. We have to figure out something fast. There's a trial going on right now. He's one of the first kids in Colorado to be on the trial. Some days we're there 8 hours, some days we're 6 hours. You're in the hospital in that situation when you're trying to help your son, but you're also away from your other kid. It just plays with your emotions because you feel like a horrible mom. So it just was really stressful. They kind of told us, have you heard of There with Care? They said, there's this wonderful program that will help you, with groceries, with toiletries, with a gas card to come to the hospital. Whatever you need help with, ask them. Julie will call us and kind of say, what do you need this week? Just meals, because we're at the hospital 3 days this week, laundry soap, some disinfectant, a snack bag. That's been one of the greatest things that you guys do for us. Things for the kids to do, things for us to make dinners. I mean, we were stuck in the hospital or we were at our house. That was our life. It all is just an amazing support that we absolutely need. You guys helped so much. It's great to get the groceries and everything, but it's a step further when you guys call and actually say, how are you doing? How is Owen doing? Even the small notes on the grocery bags, they mean a lot. You guys have been amazing to us, and we just can't say thank you enough for everything you guys do for our family.
My 25th week ultrasound, they had told me, baby looked fine, but your blood pressure's getting high. They couldn't get my blood pressures down. At this point, they were scared I was going to have a stroke and what was going to happen to baby. The hopes were just to try to get him to 34 weeks. The doctor called me that we can't wait anymore. My liver was starting to give out. And he said, this is going to start to affect the baby. He was born. They immediately took him to the NICU. I didn't know if he was going to make it. And I just saw him pass by. My little Valentine was born weighing 2 pounds. I saw him and I thought, you're here fighting for your life. You're showing me how to be strong. I kept on thinking, how am I going to make this work? I can't go back to work. I have to be here for him. And so when Andrew called further with care, I just broke down. I've never had to ask for help like this. I myself didn't quite know what I needed. When all this happened, we didn't even have time to have a baby shower. I had nothing for him. She was like, hey, we have a bag for you, for him. We have a gas card for you. And when she said that, I thought, okay, I could do this. We could do this. After I talked with her, I felt so much relief. So much relief. And my day was brighter. The first delivery that I got, I remember it was a rough day here at the hospital. And I got home and I see bags of food. A big old bag of clothes for Valentin, a stuffed toy for him. And I felt like I was providing. And it gave me a sense of empowerment again. It gave me a sense of stability, and I was grounded again.
I am thankful for everything that you do. For now and forever, I'll always be thankful for you guys.